Arkadaşlar merhaba. İstanbul'daki görüşmelerimiz devam ediyor. Şu an Doktor Courtney ile beraberiz. Kendisi Amerika'dan buraya katılmış. SAEM'in de yönetim kurulu üyesi. Onunla kritik bakımla alakalı kısa bir sohbet yapmak istiyoruz. Thanks to join us.
My pleasure. Thank you.
I want to ask that how you organize critical care units in emergency service in America, in your country?
So most of the hospitals in the United States, the emergency department sees patients who come in by ambulance or comes in on their own and takes care of the patients to identify any emergent condition, and then the patients either go home or are admitted to the hospital. Some of the patients will be admitted to an intensive care unit, and in almost all of the situations in the United States, that is a different location than the emergency department. So they may go to a medical ICU, which is 1 or 2 floors above in the hospital, or they may go to a cardiac care unit if it's a cardiac case that needs to get continued intensive care. So a big difference in the United States is almost all of the critical care, the location is different from the emergency department.
Understand. So who care these patients?
Most of the patients in the United States are taken care of in critical care by doctors who have specialty training in critical care. Usually these are internal medicine doctors, pulmonary doctors who have done a fellowship in critical care, or anesthesiologists who typically have done fellowship in critical care, or sometimes surgery doctors who have advanced training in critical care. There is now an increased number of emergency medicine doctors who are doing fellowship in critical care, and so that is an increasing trend.
Yeah. In our country, we have a big problem about the empty ICU units bed.
Mm-hmm.
So some of emergency departments start to organize little ICU units, critical care units in emergency medicine. What do you think about this? Is it good?
I think that it's the same problem that we have. We often also have too many patients in the emergency department that are waiting to go upstairs for ICU bed, and we don't have enough ICU bed also. So we have the same problem. And sometimes they will be downstairs in the emergency department for many, many, many hours with intubation, pneumonia, hypotension, and shock, and it is challenging to take care of those patients in the emergency room at the same time as everybody else. Every hospital manages this problem a little bit differently. I think it is a good idea to think about how you solve this problem in Turkey in your hospitals, and the idea of having some specialty ICU care in the emergency room makes sense.
Okay, finally I want to ask that, what do you know about the emergency medicine system in Turkey? Have you got any idea about our situation?
I don't know a lot. This is my first trip here to Turkey, first time here in Istanbul, and I've had a very good trip. I've talked with lots of people at the conference, and what I've learned is that your emergency departments are very, very busy.
Yeah.
One person told me they saw 500, 1,000 people a day at his hospital. We see on a busy day 300 people a day in my hospital, so it's a little bit different, but it all depends on how many beds you have, how many nurses you have, how many hospitals you have, but my understanding is you're very, very busy here.
Yeah. Thank you very much.
Sure, my pleasure.
Thank you.
Thank you very much.